Classical symptoms of a stroke, or the ones most people will be aware of, are a weakness in particularly one side of the body, either the leg or arm or both. But also people can get speech disturbance or weakness of the face. And there are sometimes some other rarer symptoms, but they're the sort of classic ones. So it's a weakening of one side of the body in particular, but also can be associated with an alteration in sensation. Stroke is a sort of very general term, but essentially a stroke is what happens when there's impairment of blood flow to a certain part of the brain. So the normal oxygen delivery through the circulatory system is interrupted. And that can be for a number of reasons. The most common cause is because of a blockage in one of the blood vessels in the brain, usually caused by a clot being delivered to the blood vessel from somewhere, and that's called a thrombotic stroke. Less common causes, although an important cause, is actually a bleed from a vessel in the brain, which equally causes a reduction in blood flow, and that's usually termed a hemorrhagic stroke. And it's important to know the difference because the treatment can differ. The majority of strokes, as I mentioned, are usually because of cause of a clot being delivered from somewhere. So usually it involves blood thinning medication, typically aspirin, which I'm sure many people have heard about, or a similar medication called clopidogrel. That's usually one of the most important initial treatments. And then it really depends on the underlying cause and further investigation in order to clarify what other treatments are required. Ideally, yes. I mean, when a stroke, as I mentioned, it's caused by an impairment of blood flow, and the longer the blood flow is impaired to a certain part of the brain, the more long-term the damage is going to be, and likely the more serious the damage will be. So getting it diagnosed early is important, and being seen early so that the appropriate treatment can be started early is important to try and improve the long-term outcome. And also, importantly, there's this group of strokes called mini strokes, which or TIAs, which many people may have heard of, where the neurology or the symptoms someone might experience are more transient, so it might just last a few minutes or a few hours and then disappear. It's important even to be investigated in those, because although the symptoms might completely resolve and any clot that was present might have disappeared itself, once you've had one TIA, the risk of having future episodes is very high, particularly in the first few days afterwards. So getting on appropriate treatment quickly can reduce the risk of having a full-blown stroke.